care about. WLBB, Carrollton, News Talk, 1330, FM 106.3.
And good morning. Welcome to Community Voice. I am your host, Josh Engel. Joining me in the studio today, we have Katie Gutierrez, the infection preventionist at Tanner Health Systems. Today, we're going to be talking about COVID-19. You may have heard about our friendly neighborhood virus, COVID-19, more commonly known as the coronavirus. Well, we're going to be talking about the coronavirus with a professional here and addressing some of our and your burning questions. So if you are tuning in on Facebook Live, feel free to add some questions in the comments section. And I also wanted to mention up front, if you're a local business, organization, church, any group that might be providing resources to our local community to help during this crisis, please comment on this video. Share links, tag others. We want you to alert us and other viewers to those resources, because this is a time to help our fellow man, and we want to use this platform and broadcast to spread the word. So good morning, Katie. How are you?
Good morning. I'm good. How are you?
Fantastic. Thank you for joining us.
Thank you for having us.
Well, first, why don't we talk a bit about you? Tell us a little bit about your position at Tanner.
I am an infection preventionist for Tanner Health Systems, so I provide best practice guidance to help prevent healthcare-acquired infections. I work closely with the staff. I work closely with Dr. Laura Larson with infectious diseases, and she is our hospital epidemiologist. So she's really on the front line of helping us to mitigate the coronavirus.
Excellent. So speaking of the coronavirus, there's a lot of opinions out there in regards to what COVID-19 actually is. When it first came about, it was, it's just the flu. Don't worry about it. It's the common cold. And then as more information got out to us and it drew closer and closer to home, that perception changed. So if you could, please speak to what COVID-19 actually is.
Okay, so COVID-19 is the novel coronavirus 2019. Originally, we actually have several different strains of coronavirus in the community. However, this particular strain mutated. Originally, it did not infect humans, and now it does. It started in Wuhan, China, and has progressively spread worldwide.
Sure. So how does COVID-19 spread?
It spreads through droplet particles. So if somebody coughs or sneezes, it can stay on surfaces for an extended period of time. So it's really important that you disinfect your surfaces regularly. You wash your hands with soap and water, or if you're going to use hand sanitizer, you are going to want to make sure you have gel that is at least 60% alcohol. One thing that I like to tell everybody is you want to use the acronym FROG, friction rubs out germs. So CDC guidance says that you want to wash your hands for at least 15 to 20 seconds with soap and water, or if you're using gel, you want to make sure that you get all the surfaces of your hands. One thing we like to tell the staff at Tanner is no jazz hands, but you want to just make sure that you dry it rub until it's dry, and then just cover your mouth when you cough or sneeze, and that's pretty much the basics.
So speaking of coughing and sneezing, what are the symptoms? The
symptoms are a fever of 100.4 or greater, a dry cough, or shortness of breath or difficulty breathing.
Oh, we actually just got a question on the live feed. Do you currently have any patients at Tanner right now with the coronavirus? And that was Janice Bishop Huckabee.
Okay, so we are actively testing patients daily. However, there are no confirmed positive cases at Tanner Health System or any of the patients that we've tested.
And another question came in from Juan Carlos Ferrero. I still see lots of people at restaurants and public places. There's a lot of people that do not believe this is real and critical. Please stress to people that we should stay home. Well, is Juan here correct? Should people be staying home?
I think that we should be following the guidance of CDC and President Trump. We should be doing social distancing. We should be staying home. We want to diminish the curve so that we're not actively spreading it quickly, so that hospitals have the capability to take care of these patients, so that we're not running out of resources or spaces to take care of them. And that's worldwide.
Well, speaking of the CDC, you mentioned prior to the show that Tanner has been meeting with leaders and clinicians daily from the CDC, the World Health Organization, and the Department of Public Health. How are those talks currently going?
So Dr. Larson is the Board of Health for Carroll County Director, and so she actively meets with our District 4 physician epidemiologist, and so we're actively getting updates. We're actively aware of what's in our community. They keep us posted on everything. We do go, and Dr. Larson uses the World Health Organization as well as CDC to make sure that we're providing our community partners, our patients, our employees with the most up-to-date guidance to make sure that we are keeping everybody safe.
So, what test is currently being used to identify COVID-19?
Currently, we are using a test that is being sent to a reference lab. And so once it gets collected, right now the approximate turnaround time is about a week business days.
Wow. And I saw in the news, and please correct me if I'm wrong, I saw Israel and possibly even Korea, they were testing potential tests that could produce answers quicker, 15, 20 minutes. Can you speak on that?
I can't really speak to that. I'm not an expert on that, and I haven't read up on that recently.
Sure, but let's hope that it is true and that we get those very soon.
Yes, sir.
So what should you do if you start to develop the symptoms, the aforementioned symptoms we were talking about?
Okay, so if you start to develop symptoms and they are mild symptoms, we are asking that the community stays home, self-quarantine. If you get in a spot where you feel as though you are in an emergent situation and you need to go to the hospital or urgent care or your primary care physician, be sure and call ahead. That way you're letting them know that you have the same symptoms as potentially the coronavirus or COVID-19, and that way they can work out a process for you to either come in or you to get tested. That way we're limiting the potential exposures.
For sure. So, we spoke earlier on Tanner leadership meeting with folks from the CDC, the World Health Organization, and the Department of Public Health. But what has Tanner been doing all in all? And as far as to be preparing for COVID-19's inevitable arrival to West Georgia? Okay,
so in general, we do have pandemic and surge plans that we prepare for annually, daily. That's something that we work on all the time. Once COVID became very prevalent and we suspected that it would come here, we started meeting with our community partners, and we had weekly updates with physicians, clinical staff in the hospital, just to kind of keep them abreast of what's going on and what we're doing. Dr. Larson is getting updates daily as things change, and so we're doing what we can to get that out to the community so that people are aware. We do have resources on tanner.org that keep the public updated. And so that's something we really are encouraging to stay informed. You want to go to Tanner Health System and visit tanner.org-ncov, or you can stay informed by checking out the CDC.
Perfect. Well, we're going to take a quick break now, but when we come back, we're going to get to some of the Facebook comments that have been coming in on the live feed, as well as talking a bit more about COVID-19 and the current situation with our amazing guest, Katie Gutierrez. So stick with us, and we'll be right back.
As a graduate of Oak Mountain Academy, I've found that my experience on the mountain prepared me beyond all expectations. As a junior at Auburn University, I approached my studies with great confidence thanks to what I learned at OMA. When I think back on my time on the mountain, I think of my teachers. Their genuine love and concern for me as a student was always evident, and now, as an adult, I still foster those relationships. I'm Carly Robinson, an Oak Mountain Academy alum. Visit oakmountain.us to see how you can offer your child an amazing opportunity to be a warrior.
At Tanner, we care about your health, so please wash your hands often with soap and water for at least 20 seconds, especially before eating, after bathroom breaks, blowing your nose, and after coughing or sneezing. If soap and water aren't available, use a hand sanitizer. Avoid touching your face with unwashed hands. Clean and disinfect surfaces and objects often. Cover your coughs and sneezes with a tissue or the crook of your elbow. Avoid people who are sick and stay home when you are sick, except to get medical care. See more ways to stay well online at tanner.org.
And we're back to Community Voice. I am your host, Josh Engel. Joining me in the studio today, we have infection preventionist over at Tanner Health System, Katie Gutierrez. We've been talking about COVID-19. You've heard about it. It's making the rounds across the world. It's on a world tour currently, but you should feel a little bit safer because Tanner is working very hard, meeting with professionals from the CDC, the World Health Organization, and the State Department of Public Health to make sure that we flatten that curve and slow COVID-19 in its tracks in West Georgia.
Absolutely.
It has no idea what it's in for if it comes in this area. So I have some more questions that came in on the Facebook Live, and I wanted to say this again. If you were a local business, or if you're a church or an organization, and you are providing resources to our local community to help during this crisis, please comment on this video, share links, tag others. We want you to alert us and other viewers to these resources. So let's use this platform to spread the word. If you're around here and you're doing something good, we want everyone to know. So we had some questions that came in here. This one came in from Denise Wood. How many cases of suspected COVID-19 are there in Carroll and Haralson counties?
I can't speak to how many there are in Carroll and Haralson County. I just know that we are actively testing patients that meet testing criteria.
Wonderful. So how many tests does Carrollton have?
So we have enough to facilitate screening our community, especially those that are at risk and any patients that potentially have COVID-19.
For sure. Excellent. Sure. And you may know this, I'm not sure if you will or not, but how many ICU beds are available in Tanner Health System? And what is the plan should those fill up?
We currently have 12 ICU beds at Carrollton, and I think it's 6 at Villa Rica. I can't remember for sure. And
keep in mind, listeners, she's an infection preventionist. Her expertise is in the virus and the diseases. So it's not, some of these questions might have to be saved for other guests from Tanner's in the coming weeks, which we plan on having as many as possible coming in the coming weeks to speak and inform listeners.
But we have set up wings that are safe for these patients and safe for our employees and safe for the community. We have restricted visitors right now. We have asked that the public refrain from visiting Tanner to visit a patient if you are 16 and younger, if it is not an immediate family member or significant other, if you have traveled to countries with ongoing COVID-19 activity in the past 14 days, or if you have had close contact with someone who has or is suspected of having COVID-19. We're not trying to worry the community. We're just trying to be prepared, and we are prepared. We want to really make sure that the community knows that Tanner has this. We are most diligently working to take care of these patients and these suspected patients. We don't have any confirmed. We just really want the community to not be nervous, not be scared, not be worried.
Sure. And you mentioned earlier, don't just show up at the hospital.
Absolutely.
So what should folks do? What should folks do if they're pretty convinced they have the illness?
Okay, so we have on Tanner.org the hotline that the number, not hotline, but a number that you contact, and we are actively, we have a call center set up that is screening these patients, and they are giving guidance based on the CDC's guidelines. So if you have mild symptoms, stay home, self-quarantine. If you are having difficulty breathing, that sort of thing, then they are making those kinds of recommendations to go to the emergency room, give us your name, which ER are you going to. That way we can work with our staff to make sure that we have a system of how that patient's going to come in.
For sure. So, what are your thoughts on as far as tests in the U.S.? Do we have enough tests in the U.S.? What about Carroll County?
I can't really speak to if we have enough tests for the entire U.S. I think that we are prepared for Carroll County for sure.
Excellent. And that makes me feel better. So thank you so much for bringing that information to us. How can we best protect ourselves? A lot of buzzwords are going around on social media, social distancing, for example. What can we do?
Absolutely.
To protect ourselves?
So social distancing, they're recommending 6 feet apart. You no longer want to meet in groups of 10 or more. You want to make sure, absolutely, if I can't say this enough, wash your hands, disinfect your hands. Clean surfaces. If you cough, wash your hands immediately. I know that used to the guidance was to cough into your elbow. Now the guidance is to cough into a tissue, throw the tissue away, and then disinfect your hands or wash your hands. That's, I think, pretty much what you need to do at this point in time. Just really, we want to make sure people are social distancing, not just staying out in the community, especially if you're sick. Just follow what CDC is recommending.
Excellent. And I wanted to be sure to remind everyone again, we do have a phone number here at the station, 678-601-TALK. That is 678-601-8255. If you have any questions for Ms. Gutierrez, feel free to chime in. And again, please, let's keep the questions focused on the nature of the virus. This particular show is dedicated to finding out more information about the virus. And there might be some questions that Katie might not be informed on, but some of our future guests will be. Let's see here. Well, tell me this much. Where do we go from here? What are your thoughts on the upcoming few weeks?
I think the upcoming few weeks for Tanner is that we are really staying in tune with what's going on in our community, at all of our healthcare systems. We are just really focusing on, we daily talk about our supplies and what we have and what we need. And our supplies, we have a stockpile of medical equipment and other resources to ensure that we are really able to respond to COVID and the needs of our community as this infection unfolds.
So I just wanted to read some more comments here that are coming in. Clearly, you're pretty popular. Katie Gutierrez is amazing, says Ali Williamson Trent. Chelsea Bryant Church. Way to go, Katie. Thank you for all the information and for what you are doing to help slow the progression of the disease.
Well,
that means a lot to us. Thank you for everyone that's chiming in, because this is a tough time, and we really appreciate everybody chiming in here. I wanted to ask you, who are the folks that are most at risk?
The people that are most at risk are pregnant women, individuals with diabetes, kidney disease, the elderly, really the elderly, and people with comorbidities like COPD, lung diseases, and that sort of thing.
Excellent. Let's see here. We have some other questions coming in. They have people waiting on results, but it takes a week. No confirmed cases yet at the hospital. That was a comment that came on. Can you speak to that at all?
Like I said, we have no confirmed cases. The turnaround time is about a week right now with the reference lab. We do have tests that are pending results, and as we get those, our call center is calling the negatives. When we have a positive, if and when we have a positive, we will work directly with our community partners and the Department of Public Health to notify our community of that confirmed positive when we have it.
For sure. And yes, if that positive is confirmed, tune in to our stations, particularly here, WLBB, or listen to any news break with Colin Worthington, the news director, and you will find out here first, I'm telling you. So we're going to take another quick break. When we come back, we're going to speak more with Katie Gutierrez, the infection preventionist at Tanner Health Systems, about COVID-19. More commonly known as the coronavirus. And I wanted to say this again, as this is a pretty popular program right now, so I want to make sure everyone knows, if you're a local business or church or organization and you're providing resources to our local community, please comment on this video, share links, tag others, alert us and other viewers to those resources. So we're trying to spread the word. So stick around and we'll be right back.
At Tanner, we care about your health, so please wash your hands often with soap and water for at least 20 seconds, especially before eating, after bathroom breaks, blowing your nose, and after coughing or sneezing. If soap and water aren't available, use a hand sanitizer. Avoid touching your face with unwashed hands. Clean and disinfect surfaces and objects often. Cover your coughs and sneezes with a tissue or the crook of your elbow. Avoid people who are sick, and stay home when you are sick, except to get medical care. See more ways to stay well online at tanner.org.
At Oak Mountain Academy, our daily schedule includes convocation, prayer, and the Pledge of Allegiance. By doing so, we build a family-like community where all students grow and flourish and personal faith is encouraged. Through community service and a historical approach to biblical study, our students are taught the value of the warrior way, honesty, respect, and responsibility. Oak Mountain Academy. We are a family creating legacies. To learn more, visit oakmountain.us.
And we're back to Community Voice. I'm your host, Josh Engel. Thank you for tuning in. We have Katie Gutierrez, the infection preventionist at Tanner Health System. She's on the program today. We're talking about COVID-19, the coronavirus. If you are just tuning in, please be sure to go check out our WLBB Facebook. You can watch this entire Facebook Live program. Yes, it's being Facebook Lived in beautiful, crisp, high definition. You can actually watch the program, and you can also call in if you'd like, 678-601-TALK. Let's keep the questions focused on the virus, because in the coming weeks we'll have more experts coming in, and they can probably speak to more technical information regarding the hospital, or we'll have doctors. But right now we're talking with an expert about infectious diseases, and we want to stick to that. So if you have any calls, feel free to call in, 678-601-TALK. That's 678-601-8255. So honestly, Katie, overall something, and I'm thankful that we have this feeling of preparation here. But I mean, Tanner seems to be prepared for this.
Tanner is absolutely prepared. We have the best physicians, the best clinicians, the best nursing staff, lab staff, radiology staff, EVS staff. I mean, really and truly, our all of the employees at Tanner are well prepared. We just really want to make sure that the community knows that we are here to serve you, and we want to make sure that we are being very transparent. We just really, I feel as though we really are capable of handling coronavirus or COVID-19.
For sure. And we have a question that came in here from Denise Wood. How are possible suspected, and we've covered this a bit in the show, but let's go back.
Okay.
How are, let's say someone comes in, they have all the symptoms.
Mm-hmm.
This person possibly has COVID-19. Mm-hmm. How are these possible suspected cases of COVID-19 being treated? So what's the process?
So currently what we are doing is they will screen them based on symptomology. The physician will determine whether or not the patient meets testing criteria. At that point, we are treating the patient's symptoms. I can't go really into specifics on if they're using this or that. Later on, if Dr. Laura Larson comes on the show, she will really be able to speak to that. But we are isolating those patients. We are limiting access to those patients. I'm trying to think of anything else.
Well, Dwayne Crowder Jr. just wrote in on Facebook and said, realistically, how long could this go on?
What did he say? I'm
sorry. Realistically, how long could this whole situation go on? I know that folks are ready to get back to work.
I really can't speak
to
that. Really, if you look at history and look at the pandemics in past, I really can't speak. I can't put a timeline on it. Could it be over this summer? Maybe. Could it be over in December of this year? Maybe. We can't speak to that right now because we're on the upward tick of the trending of this epidemiological infection.
Now, I wanted to ask, this is my own curiosity here. How does something like this start? How does this virus become, how is it born?
Well, all viruses, bacteria, organisms are present and prevalent in the community. Actually, we have bacteria on our skin that's normal to you and I. So these viruses just are, in the community, and this one, unfortunately, it mutated and has started getting people sick, really, really bad sick.
So I was watching a video last night, and it was on 60 Minutes. They were at the wet market, apparently, where where people could buy live bats. I guess some folks eat weird stuff. I don't know. I don't eat live bats. If I eat a bat, I'm going to cook it. All right. If I'm going to eat a bat, I'm going to cook it. So can you speak to that at all? Considering that
the only thing that I can speak to on that is just that it's suspected that these originated from bats. That's all I know at this time.
A question came in here, another question with Denise Wood's been on it. She's been sending in a few questions
Denise.
here. How is Tanner working with nursing homes and assisted living centers?
So as we have these suspected cases or patients that are coming in, I know that the nursing homes locally are closed off to visitors, but we're communicating what we are doing in the community with all of our community partners, and that includes nursing homes. So if we had a suspected patient that needed to be transported to a nursing home, we're working with them very closely.
And I know that we've covered this before, but again, I want folks that are maybe driving in their cars. This is pertinent information. One more time, how can we best protect ourselves? If you're listening and you missed it earlier, I would rather you go check out the Facebook Live feed, but how can you protect yourself from possibly contracting?
Social distancing, absolutely. Stay home. If you are sick, stay home. Mildly sick, if you're sick, stay home. Wash your hands. I cannot speak to that enough. The single most important tool in preventing the spread of infections is hand hygiene. Wash your hands. Just following those things and disinfecting periodically would really be beneficial.
So we've got a question here from Tina Shockley. Does this virus have the characteristics of subsiding in warmer weather?
I cannot speak to that. That is not something that I know that I've heard things, but I don't feel comfortable talking about that.
No, for sure. And again, there are questions that we're not going to be able to answer, and I want people tuning in to understand that. Thankfully, Katie can answer a vast more questions than I can. So thank you so much again for being here with us. Now, we only have about 4 minutes left, so I really wanted to give that time to you. Okay. Get some information out there.
Okay.
What are things that are most important that you want listeners and viewers to know about what's happening, about steps? Just take it out. Take it away.
So we have closed off a lot of our entrances, and we are screening visitors, actively screening visitors. Please, don't get hysterical or irate. This is for your protection, the protection of our employees, the protection of the community, the protection of patients. Also, again, we are well equipped and prepared for the COVID-19. We have plenty of personal protective equipment for our staff. We are assessing this daily, and we are talking with our community partners like the public health. If there are any needs, we have a pandemic supply of personal protective equipment, so N95s, gloves, gowns, goggles. We are really working towards making sure that we keep our providers and staff and employees and community safe.
So if you have symptoms, if you're showing symptoms, and those symptoms one more time.
If they are mild, follow the recommendations of the CDC. We want you to stay home, self-quarantine. If you are getting into trouble, call before you show up. Absolutely call before you show up. We do have with some of our practices and like surgical services, they are actively calling the day before to make sure that patients are not sick and showing up. If you are sick before your appointment and say you weren't the day before when they called, make sure you call that morning and let them know what's going on. It's really, really important during this time that we just notify and keep everybody abreast of what's going on.
We got a question. It's actually before that one though. What is considered mild symptoms?
Fever. I think it's just a case-by-case basis, but just a fever. If it can be controlled by medication, if you get into trouble, that's, we really want to make sure that you're coming to the emergency room.
Well, I wanted to start wrapping up with this question here. Well, not really a question. It's a comment from Robin Barfield. She says, prayers for all the healthcare workers and all confirmed and suspected cases. Now, the reason I bring that up is I want to say thank you to the healthcare professionals at Tanner, you, Katie, all the doctors, the paramedics that may be out there picking people up. This, as we've seen, people have chosen to panic. And that's not the way to respond to this.
Absolutely.
Be informed. Go to the CDC's website, cdc.gov/COVID-19. You can also go to tanner.org/NCOV to find out more information. Katie, thank you so much for joining us today.
Thank you for having me.
And I'm not going to shake your hand.
No, elbow.
All right. And thank you for tuning in. We'll see you next time.
All right. Thank you.